Hello, and welcome to my podcast, Alive and Kicking. I'm Coach Lisa Renee, and I'm thrilled to have you here because you're going to get to know my guest and myself, and how we're able to live the lifestyle we are. Because we're old, but we don't look old. We're energetic. We can do the same things we did in our 20s and 30s. We're all the way live while we're growing older. See, I'm 65 years old. And I've heard it all. I've heard you don't look your age. You could still run. You could still jump. You roller skate. You could do cartwheels. I love to do push-ups. How do I do it? Well, stick around because I'm going to show you. I'm going to share with you what I do, and also I'm going to have guests on that's going to do the same thing, along with experts who are going to share some scientifically based information that you can apply right away. Because as you've noticed, look around you. There are many of us. We are thriving past the ages of 45, 50, 60, and even 70. We aren't nothing like your grandparents. And I can't wait for you to meet my guest and see what they're doing to be energetic and very healthy. So you don't want to miss an episode. So hit the subscribe button and don't forget to hit the notification bell because you don't want to miss an uploaded video or any of my podcast episodes. So go ahead and do that now. I'll wait. Did you subscribe? Did you hit the notification bell? Great. I'm going to ask you to do one more thing. Please like this video and leave a comment. We want to hear what you think. Today, though, I'd like to welcome our featured guest, Dr. Harold Wagner, double board certified emergency and internal medicine physician out of Dallas, Texas. Now, he's retired. He retired to reclaim his health, and he's going to share some groundbreaking medical breakthroughs along with his personal story. See, he was afflicted with some of the things you've seen a lot of adults have these days, the high blood pressure, the cardiovascular disease, the high cholesterol, the diabetes. He was able to get off his medication and he changed his life. Let's welcome together Dr. Harold Wagner. He has got the story. Let me tell you first real quick how we met. I got a message from this doctor and he said, "Hey, are you available to do some virtual training, some online fitness training for my clients? Because I'm going to be working with a weight loss clinic." And I said, "Sure, but I'm not set up yet." And he goes, "Perfect." I went, "Okay." So the reason why it was perfect is because he is also just beginning his weight loss clinic. He's working with clients on losing weight. And after you hear Dr. Harold Wagner's story, you're going to see why. If you're in the Dallas area, you definitely want to meet this man and have him work with you on obesity, on diabesity, losing weight, working out over 60, any of that. He's perfect for that. But first, let me introduce you to Dr. Harold Wagner. And Dr. Wagner, tell us your story. Tell the story that you told me when we first talked on the phone.
My story, Coach Lisa, is I was in the worst physical shape of my life. And after gaining so much weight, I was in the position where I had to move and take care of myself. And through the pandemic,
what were you doing? Let me stop you real quick. What were you doing at that time? You had something really interesting that you were doing. Were you working in the hospital? Where were you working at?
During that time when I retired, I was making house calls. I was doing internal medicine house calls. Basically, I was going into patient homes and doing anything that could be done in the internal medicine office, plus if they needed therapy, which would have been done at a hospital, I was able to do it in a patient's home because I had the
Mhm.
technology with IV therapy, X-rays, EKGs, phlebotomy, medication, and nursing services. So basically, it was like a one-stop shop for getting diagnosed chronic and acute care. And basically, I was the only one in the DFW area that was doing that. And subsequently, a few hospitals did not like me because
Why? Why?
because
You were
when
taking their patients,
yes,
maybe?
when I got a phone call such as little grandma got a blood clot in her leg, we're gonna admit her to the hospital. And
Mm-hmm.
I would call them and say, "Come on now, you know that blood clot is below her knee, and the
Mm-hmm.
chances of that blood clot turning into something terrible going to her lungs are nil. Now, if it's in the upper leg, maybe below the knee, all she actually did it was a anticoagulant shot. She would get 2 times a day and start on a pill which would make her blood thin. She could do that at home. And whenever I did that, the hospital probably lost about $15,000 to $20,000 of revenue, and it had got
So,
to.
doctor, were you seeing patients? So that means you were seeing older patients,
Oh yeah,
seniors, geriatrics. You were focusing on that.
yeah.
For
That was my service was to elderly patients, Medicare plus.
okay, okay.
Mhm.
So yeah, you were taking. So of course they were calling you to come to their house because it's a pain. I have an older mother. I had an elderly mother that I was caring for, and with cancer. And
Oh
so,
wow.
how do you take them to all their appointments? I mean, my brother after a while put her on an Uber. I wish we had a Dr. W in our area to come to do house calls for my mom.
It did save the family a lot of trouble and strife because, like I said, anything that could be done in the doctor's office with the technology beginning of in-home hospital and house calls, you could do a lot in a person's home, especially if there were good nursing agencies and or hospice agencies to help you.
Now, okay. So, how many days a week did you work?
Um, Sometimes
Yeah.
through Monday through Friday, I did my internal medicine house call, and Friday through Saturday, I would work at a bariatric hospital where they did the gastric bypasses, the gastric sleeves, the lap bands, and I would take care of patients that had just had those procedures from Friday night until to Monday morning. And but a lot of time I was able to sleep, so it wasn't that bad. But I did monitor all the post surgical bypass gastric surgeons, and that's how I really got interested into weight loss medicine, obesity medicine, because I took care of so many patients that had obesity related issues, high blood pressure, cancers, diabetes, and then a lot of them had behavioral issues. And I noticed that with these behavioral issues, they had trouble losing weight. And a lot of them would get the gastric bypass, and then they still had that component that they didn't make the behavior changes, lifestyle changes. And as I later learned, there are faith changes, some fitness changes that should have been made too. And I just like obesity bariatric medicine. I just loved it.
Well, okay. So while you're working all those hours, and you mentioned that you got sick,
Yes.
doing all that work, working all those hours, explain what happened to you. What happened to your
I
health?
followed the doctor's advice and I took insulin around the clock.
But why did you take insulin?
I was taking it during the day.
So you were diagnosed.
Yeah, I've been diabetic since 1995.
Okay, okay.
And one of the issues with diabetes is when you're on insulin, you gain weight. And
Okay.
my weight just ballooned up to close to 300 pounds. I would lose it. I would gain it back, get down to 240. Then I get back to 300. I would just go back and forth like a yo-yo.
Well, how are you able to do all that work gaining the weight? I mean, weren't
Oh,
you having a hard time moving around? What,
yeah.
you were 300 pounds?
No, March, I didn't get to 300 pounds till right after I retired. I was close to 300 pounds when I was in practice. But when I retired, I got up to 300 pounds plus. And to answer that question, I was so sedentary that I could not even go to the post, to go to the mailbox without getting short of breath. And I had actually been put on oxygen.
Wow.
Breathing treatments.
Oxygen, explain that
Okay.
to those of, so there's some people that don't know that when you get so overweight, your oxygen levels lower, or explain that.
What happened is when I would get up to walk, I would get winded. And one day I'm seeing my PCP, and she noticed how short of breath I was. So she had me do a walk where she put a monitor on me. And normally it takes a few minutes for the monitor to go down to magic number was 88, 87%. 2 minutes, Lisa, mine went down to 83%. That meant I qualified for home oxygen around the clock. In addition to, taking the breathing treatments for mild asthma, COPD, emphysema.
Wow. So you pretty much were homebound.
Oh, I was homebound. Unless I was going to the Burger King, I was homebound.
Oh, I was gonna say, did you, in your mind as a physician, you knew so much about medicine, so much about your body. Why didn't you start an exercise program before that? Like, I don't understand.
I tried to do an exercise program, but due to time constraints and other issues and being so deconditioned, I couldn't. I even tried to hook myself up to an oxygen tank and take a walk. But I had de-escalated to the point that I couldn't do anything. So I had given up. I gave up.
Okay, because you gave up because you just didn't feel well.
I thought I was doing everything medically, but I was still having problems with my diabetes, my heart, high blood pressure, cardiovascular issues with hardening of the arteries. I was basically, Lisa, a metabolic mess, just waiting
oh my gosh.
for an accident.
So what happened? I mean, look
even,
at you now. You don't look heavy. What? Actually, you look super lean. And like, can you tell everybody on my podcast listening, how old are you?
What I did was I learned one fact. I learned that even though I'm diabetic, I was taking insulin. Insulin was toxic to my body, as it is to a lot of people. A lot of people have, quote, they may hear what they call metabolic syndrome and insulin resistance. Mine was a very high case of insulin resistance to the point that when I was taking insulin, I could not lose weight. The insulin was causing my body to store the fat around my liver. I had a fatty liver. I had a fatty pancreas. My waist size had ballooned to about a 48. Now I'm down to a 34. My waist size was 48. It was nothing but pure fat. And I started doing research. And I learned two things. What I learned in medical school about diabetic was wrong. And what I learned from the American Diabetic Association with their theories on how to treat diabetic patients was wrong.
Okay, well, let me ask you this. So we all do research. I do research. I've been doing research as a hobby, right? Just reading all kind of things. And your research is a little bit more scientifically based, right? Um, you had patients just like yourself, and you didn't treat them. You treat them where they taught you in medical school. So
Yeah.
what happened to you after getting the research? What did you do with that information?
I decided to stop taking the insulin and to start doing intermittent fasting.
So, but you just didn't stop. I mean, like this, we're not
No,
giving medical advice at all here. We're just telling Doctor's story. So, what happened before that? What triggered you to do something?
I had got to the point that I was miserable. I had no life. I was uh matter of fact, I even have a T-shirt where I look like that guy from the Nutty Professor, Eddie Murphy.
Mm-hmm.
I was
Mm-hmm.
I was so roly poly and uptonded. I
Yeah.
looked like Nutty Professor, and I would just miss. I was just sick and tired of being sick and tired. So I made that decision to do the research and find out why diabetics do have so much trouble losing weight. One thing that I did learn in my research, Lisa, if you go back one generation, or maybe a generation and a half, you go back to 1980, there was no such thing as a diabetic diabetic problem like it is now. There was no such thing as a fatty liver epidemic, no such thing as an obesity epidemic. All of this started in the early 80s. Now, half of America has a fatty liver. Half of all Black people are prone to obesity and
Yeah.
diabetes. Half. And it's sadly 80% of all Black women are overweight. If you factor in a BMI greater than 20, my definition, a BMI greater than 27, which doesn't mean much based on the background of the BMI. But if you go by those tables, 80% of all Black women are overweight. And I just figured out it had to be a different way. And since, I mean, my training was in internal medicine, acute care medicine, emergency medicine, but I was trained as a DO, which tenants are in holistic medicine.
Right. Full
So,
body.
yeah.
Yeah. Full body.
So I figured out a program where I would integrate my mind, body, and soul
There you go. Yep.
with spiritual awareness to know that I need faith, I need God, I need the fitness, I need the intermittent fasting. So I put together a program that I call the 3 F's: fasting, fitness, and faith. And every morning I do the faith part. I get in my chair, my uh, something came across my screen. I don't know if you saw
That's
it.
a no. I
Okay,
didn't. We didn't get to see it. No, but don't worry about Doctor. No,
okay,
we
okay,
don't get to see all the text
okay.
messages you're getting from your
Uh,
grandkids or whatever. We don't get to see it.
so every morning when I was weighing 300 pounds, I decided to pray, meditate, and give gratitude. And by
Mm-hmm.
doing that, I was able to break the cycle of my sugar cravings, my addiction to
Interesting.
carbohydrates. And I learned that because I get up in the morning, it doesn't mean I need to drink orange juice, eat cinnamon roll, pancakes, and high carbs. Because once you start doing that, the refined carbs will cause you to want more carbs. And so I learned to do time restricted eating. And at the same time, I did the fitness part, which means walk. At first, I could only walk maybe 200 steps without getting short of breath.
Mm.
Then I got up to maybe 400 steps. Then I got to 1,000 steps, to me, which is half a mile. And Lisa, the day that I was able to look on my phone and I had walked 1 mile, I would never forget
Yeah.
the day. I looked up and said, "Thank you, Jesus. Thank you." People thought I was having a seizure. I was so happy. I started almost crying. I was so happy because I thought the day would never come where me at the age of 65, being able to walk a mile without any, on my own. Because 5 months before that, I couldn't even walk 200 feet to go watch my grandson play baseball without having to take
Mm-hmm.
treatment. And now
Well,
here I am.
you were seeing a physician, right? You were getting your blood test done. You were
Oh
getting
yeah.
all that done. What were your numbers? How
Oh,
I
oh,
want
oh,
it because most people go to the doctor and they don't pay attention to those numbers.
okay.
And as a personal trainer, as a I advise people as a coach, fitness coach, know your numbers.
Okay.
How did that work with you?
My numbers were off the wall as far as my cholesterol were high, my
Mm-hmm.
triglycerides, HDL, my LDL, my lipid, my cholesterol numbers were terrible. My
How
diet,
many medications were you on
oh, I was
when
on,
you retired, let's say?
okay, I was on 3 blood pressure medicines, 2 insulin medicine,
Wow.
2 breathing medicines, a baby aspirin, and a cholesterol medicine on a daily basis.
So that's the average, doctor.
Yeah, yeah,
As you know, that's
yeah.
eight. That's eight. I'm a former pharmaceutical rep with Pfizer. I had pain medicine though. Still, I had the geriatric
Oh,
group too.
I
But they
forgot
said 8 medicines is the average.
pain medicine too. I just didn't want to tell you. Look,
Oh,
back
we
then,
don't.
that was before Norco was made
Yeah,
as Schedule 3.
yeah.
And back then, you could get hydrocodone Norco like candy. And since I always had chronic joint pain, knee pain, back pain, I always needed hydrocodone because I couldn't walk. I was in so much pain, along with the
And
breathing.
that's the poison of being obese. That
Yeah.
you were poisoning yourself with the
Mhm.
sugar and the carbs and the not moving, just the whole unhealthy lifestyle. You were poisoning your body, and that's why you were aching.
I didn't get to tell you about my hemoglobin A1C. It,
But tell
it,
them, tell them.
it was
Wait, first of all, what's the hemoglobin? What's
okay,
hemoglobin?
wait,
Explain that.
okay, the hemoglobin A1C is the test the doctor does in office on your red blood cell. It
Okay.
goes back 90 to 120 days to tell you how well your blood sugar has been. Instead of being a snapshot, it's like a survey. And normally, when your hemoglobin A1C is above 5.9 or 6, they call it prediabetes. When it's above 6.5, 6.6, you're a diabetic. But in actuality, when you go to the doctor and he tells you your hemoglobin A1C is this, you better run because you are probably a type 2 diabetic with insulin resistance.
Okay, we're gonna get into more of that
Okay,
details
yeah,
because we're gonna have a
yeah.
part
Now,
2,
Lisa, if
part
I would have
3,
known
part
this, I would have
4.
been a sick man.
Right. We're gonna get into when you go to the doctors and they tell you this. We're gonna say, hey, this is what we did.
Uh-huh.
We can't give any medical advice. That's not what we're here to do. We're sharing our story. We're sharing things that we did.
Yes,
And
but
we want you to pay attention. We want to be your own health advocate. We want you to know your numbers. When the doctor tells you something, know what he's saying and know that you need to do something about your lifestyle and not think about just getting on medication.
but Lisa, if you think back what I said a while ago, if you go back one generation,
Uh-huh.
there was no epidemic in obesity. There was
That's
no
right.
epidemic
That's right.
in diabetes. There was no epidemic in fatty livers, and I could say a fatty pancreas too, but I'm not going to stretch it to a fatty pancreas.
So you're talking about our parents. Are you talking
Uh-huh.
about when you say one generation, because there's some younger people on here, you're talking about
Back in the
people
80s.
who were born in their 30s,
Uh-huh.
people who were born in they were born in their 30s, like my mom and dad, 34, 36, right? Maybe
Yeah.
they're born in 1940,
Yeah.
right? And they're gone probably now, right?
Yeah.
They
Yeah.
they didn't have McDonald's every day,
They didn't have the
right?
obesity problem, diabetic
Yeah.
problem, fatty liver problem we have now. Back
So
uh,
was your background like that? Okay, so we
uh
were raised
some of my
by
family,
yeah. What was
oh,
your family background like?
we ate
Yeah.
fried chicken and cornbread and potatoes every day.
Okay.
And
But
if
you didn't go to
you could,
McDonald's.
And if you're good, maybe you get some Bluebell. And then if you go across the street across Mr. Jones' yard, Mama may let you go to McDonald's and get a Big Mac.
Maybe you didn't go every day. You
Yeah.
didn't go every. You didn't have a. No wait. You have fried chicken and cornbread homemade. And you didn't have all that processed food or French fries and that didn't even potatoes. But you still had. It was still fatty. Yes, it was still fatty.
Still full of carbs and refined carbohydrates.
Yes.
Yeah, which is not the best. Which is not the best for your body.
Right.
But Lisa, let's talk back about when you go to the doctor's office. Let's
talk about that.
That is a bone of contention. A lot of people that you don't have an issue. There's a test called a fasting insulin. Most people will have a high fasting insulin before they become pre-diabetic or diabetic. When I say high, you want a normal to be about 6 or 7. It could be about 10, 11, 12, 13. What does that mean? A high fasting insulin means your body is insulin resistant and is storing all of this fat. You are never burning your fat because it's storing. You're storing fat.
Okay. So then let's go back to your story. That was you.
That was me.
You were storing fat, getting bigger, not being able to walk. You felt bad, so therefore you didn't move. And then eventually it was hard for you. You had to retire. You couldn't practice. You couldn't move. You couldn't go house to house.
Couldn't do anything.
You couldn't do anything. So you prayed.
Meditate.
You got your spiritual
gratitude to my God. And that
what really helped you?
Yes, it did.
Once you prayed and you got a little bit of discipline in you and everything, but what helped you a lot was I know we talked about this because you had me do it. The time restricted eating. And it's not just the time. It's not when you eat. It's also what you eat. You hear that all the time. So what happens if I said, okay, I'm going to do the time restricted. I'm going to do it, right? Okay. And I'm going to have cornbread. My first meal, my time restricted, I'm going to only eat 8 hours. That's right. A lot of people will do 12 hours or 16 hours of fasting and then 8 hours of a window of eating, right? Is that when you first start, right? Sometimes you could lower it. Okay, that's time restricted. What happens if I decide to have the cornbread, the mashed potatoes with gravy, the fried chicken for my first meal? What happens?
Basically, you're wasting your time because by you having that high carbohydrate load, you're going to increase your insulin. And your insulin is going to stop your body from burning the fat, which is what you want in time restricted eating. And on the same token, you are going to spike your insulin for an extended period. You're going to plateau for a long time. And what's going to happen is you're not going to lose any weight.
So what did you do? How did you get to that? How did you get to that point where you found out that you had to eat a certain type of food when you broke your fast? What happened?
Okay. What happened was I figured from doing my research, I figured out that all these foods that they're telling us to eat, the shakes, the protein bars, and all this other stuff, it's not good for your body as far as insulin resistance. And from trial and error, I learned that if I were to do one time restricted eating and eat that one meal or 2 meals or a snack and a meal during the day, I learned what my body could handle. Because if you eat the wrong foods, you're going to have that rush and it's going to cause you to have some GI problems and you're not going to feel well.
So what did you eat? What was your first meal that you ate? Usually?
I was
typical.
Probably around 1 o'clock or 2 o'clock, I would eat a scrambled egg. That was my meal, scrambled egg. And when I say meal, that includes snack. When I started my program, I eliminated all snacks because if I were to eat a Twinkie or whatever, that would be considered a meal. So I was only limited to 2 meals a day between a 6 hour time period.
Did you count calories? Did you
No,
count
no,
any
okay,
calories? No,
okay, okay.
you just went on eating
Okay.
clean, right?
Yeah, I ate clean. When I say clean, I ate the healthy fats,
Mm-hmm.
moderate protein, low carbs, and decent fiber. You got to
What
have
about a Diet Coke? Did you have a Diet Coke? There's no sugar in Diet Coke.
there's no sugar in Diet Coke, but what's in Diet Coke is an
Tell
insulin
them.
release. Because soon as your tongue tastes the sugar from a Diet Coke, you're going to release insulin. So it's a falsehood when people say I'm going to take a diet drink to lose weight, because you won't. You still will be storing fat.
Well, how are you able? Because I know all of us, we've struggled. And when I met you, I told you I do intermittent fasting, but what you're actually talking about is time resistant. But I
Uh-huh.
did intermittent, but I was told you can eat whatever you want as long as you eat within that window. And so what would happen is I would crave
Uh-huh.
what fruit snacks. I'd want to have like chips, after my window. I'm like starving, I'm hungry.
Okay,
And it's because I ate something. I ate some carbs or
okay.
something, right?
Let's talk about the reason why some people will do an intermittent fasting and eat whatever they want to eat. You have to bounce off the fact that, do you want to restrict your calories, or do you want to restrict your insulin release? You
There,
can you can go down to 1,500 calories in a restricted manner, and your body will adjust to it. Your body set point will adjust to it, and your metabolic rate will change, where you will still not lose weight when you do calorie restriction eating throughout the day.
mm-hmm.
But if you eat during a certain window and you're giving your body time to not eat, not spike your insulin, you do better. So it's kind of like having a training wheel. You do intermittent fasting, what you call it, a time restricted, whatever you want to call it. You eat what you want to eat, but just remember, you only eat it during that time. I'm not saying that's the best thing to do if you want to lose weight, but it's better than doing a caloric restriction diet, because you would definitely not lose weight and you will gain it back. So
What you taught me,
one evil against the other
to
evil.
get rid of my cravings. My cravings, I was eating whatever I wanted to eat,
Mm-hmm.
but I'm insulin resistant, like you said.
Mm-hmm.
So when you had me get off of all that, I did not have those cravings
That's how it
for, I
works.
don't know, chocolate. That's a food group, isn't it, doctors? It's chocolate candy.
A lot of people,
It's a food group to me. It was.
Yeah.
I didn't want any of that. And you don't require
No,
all of those carbs
no.
if you take that out of your diet.
So the way that I don't like to use technical terms when I talk about the hunger hormones, but there's two of them. One is called leptin and one is called ghrelin.
And
If
they've read about it, I'm sure.
if you can monitor your eating, you'll get a change in these hormones. These are the hormones that go to the brain and make you say, hey, I need to eat, or two, I need to stop eating because I'm full. These are the hormones that are kind of regulated when you take those Zembic and the Manjaro, Wegovy, or Zepbound.
Okay.
The
So
same.
I want to leave our audience with, when you come back on, you're going to do a little bit of, I don't know, interview counseling. You're going to counsel me and my audience on what we should do. What I want to find out right now, though, is what's the difference now when you were obese? Wait, what do you call it? Diabetes? Diabetes?
Called diabetes. It's a
Versus now.
of two words, diabetes and obesity, because many of the people, I have a saying, what comes first, diabetes or the obesity, or the
Yeah.
obesity, then the diabetes? To
Right.
me, they're hand in hand, because a lot of people that have type 2 diabetes, adult onset diabetes, I don't care what you call it, are overweight. And the issue is it's a fat storage problem, a fat dysregulation problem, because the person is having more insulin than he needs.
Right. So
You
how do
need
you feel? How did it make you feel? I mean, go through the progression of,
okay.
I mean, as you started losing weight, how did you feel?
Oh, I felt like in the beginning, it was like, wow, uh, I would normally lose maybe 10, 20 pounds. I would plateau, gain it back. But once I started my, my regimen, what I call the 3 F's, the faith, fasting, and the fitness, I just, in a linear progression, I lost the weight. I started at
What kind of fitness did you do? What did you
basically like the walking.
do? Mm-hmm.
200 steps one day, then 300 steps one day. Well, to the point now, I walk 3 or 4 miles a day with 8-pound weights. And
Right. The weights,
I do
yeah.
sprint training. I do sprint training. I do about 10, 70 to 80-meter runs 3 times a week. I do track practice because I want to run track later.
Can you imagine that you were able to do this?
No,
What?
no way.
This happened when you were 63, 64, even in
Yeah,
your 50s? Could you imagine you were going to be
I would have
practicing, I mean,
never would have
training for
told
sprinting?
if someone would have told me I'd be training to run in track meet, I would tell them where they get their weed from. Where you get that weed from? From what? And here I am. In next month, I'm running in a senior masters track meet.
Okay. And all that is from what? Monitoring your
From
insulin, getting balancing your hormones,
balance,
really, really, right?
it's based on your hormones. I mean, when I say hormones, I'm even talking about the women that are perimenopause,
Mhm.
postmenopause.
That's me.
They have hormonal issues, and then I'm not even talking about your cortisol levels, which fluctuates. And
Mhm.
a side note, Lisa, did you know that Black women have the highest amount of cortisol than any race of people? Black women.
Well, we carry our stress in our
Yeah,
gut.
but
We carry our stress
yeah,
there. So I heard about, and then what about sleep? How many? I mean, we're
definitely,
taking care of households, we're
definitely.
working, you know. So
Uh,
I mean, and I know you know Black women, but we were, like I said, we're gonna counsel some people. We're gonna go ahead and we're gonna take them to fitness church, right? We're gonna take them to fitness church a few times,
uh,
but I want to see how it changed your life.
I
Explain to
have,
people how that works.
since I've lost 140 pounds, I have a new life.
Okay.
If someone would have told me that this I would go through this, I would say no way, no way, because I was taught that diabetes was a progressive chronic disease, and now if I get complete blood work, they can't even see any trace of diabetes in me. My
So
hemoglobin.
is that in remission or did you cure? Did you cure it?
Well,
I mean, what is it?
okay, okay.
I mean,
No one.
no one can cure it,
So
right?
diabetes is kind of like cancer. No one gonna say you get in remission or it's
Okay.
cured, but as far as I can feel, I am cured because I would never have a problem with diabetes for the rest of my life because I don't plan on eating wrong. I'm gonna continue to get my aerobic activity, and I'm not taking any medicine. And most doctors will tell you that you can never beat diabetes. It's
Right. You
progressive.
never take it. I hear that all the time.
Yeah.
And I do know I do have personal friends
Mhm.
that did not like the weight gain. They were professional athletes. They did not like the weight gain, taking the insulin, and
Mhm.
they just got off of it, but they did not change their lifestyle, their eating habits. They
Mhm.
kept everything the same, and they're no longer with us today, and they're in their 50s, 60s, just because they got off of their insulin. So you definitely don't want to do that. You have to change your lifestyle.
And even people that have cardiac disease, heart disease,
Yes.
you can reverse that too. Because I was told I had chest pain about 12 years ago. It's not a secret. I went to the hospital. I was told I had a single blockage, and at the rate I was going, that I would be dead within a few years with needing a triple bypass. And unfortunately, that scared me because my father died getting a triple bypass. He died on the table. So there is heart disease in my family. And then with me having diabetes, high blood pressure, I have all the risk factors.
Oh, that's a ticking time bomb right there, because my father died at 60.
Yeah.
Cardiovascular and diabetes. That's a ticking time bomb.
Yeah, it's a macrovascular disease. It gets all the arteries, your brain, your heart, your nerves.
Yeah.
It's quite so devastating, but it can be beaten. That's why I started this program called Nora Beyond 50, Black Beyond 50, Time to Change. And if I can help one person accomplish what I did, which was lose 140 pounds, get off all your medicines. When I say all your medicines, and have a healthy life, I've done my job.
Right. Yeah.
Already.
Well, I want to have you back on again,
okay,
because what we're gonna do is I think right now, I'm thinking we're just teasing people now, because they want details. They want to know, how much do you walk? How much do you eat? What time do you eat? What time? We're gonna go back and go
walk, and
all of that. I want you to come back, and actually do a detailed, almost like a counseling. Like if a client would come to you, I'm going to pretend like I'm a client, and I'm going to come to you,
and I'm going to give you my 20 holistic, and I'm going to give you my 20 holistic rules to weight loss.
I can't wait. I can't wait. And then I know that Doctor is also getting his certification. Can I share with them?
Yeah, of course, yeah.
He's getting his certification from a well-known, and we don't want to give him any, even though I'm certified personal trainer with the same group, but we're not going to give him any plugs because there's a bunch out there. But he's about to get his certification as a weight loss specialist, and but it has a lot to do with not just eating, but it has a lot to do with fitness, correct? Workouts and stuff like that as well. Yeah. So
definitely part of it.
So you're studying everything on top of your medical background. And what I tell everybody all the time, and this is coming straight from a doctor's mouth now, you guys, please listen to me. You have to be your own health advocate.
Yes,
your doctor is not trained. Doctor, tell them you are going through what I had to go through, basically the type of training I had to go to teach people how to work out, how to exercise, and learn how to design programs for them. You're going through that now. Did they offer that to you when you were in med school?
No, we got no training on nutrition.
So why do patients ask their doctors to help them in that area? Because they're not even trained. They're not trained for that. That's why you have to be your own health advocate. They're not trained.
If you could figure that out, I have a question for you. Why do people go to the room and they're about to get their blood drawn, and they say, you only get one stick to draw my blood? If you can't do it, I'm going to make the doctor do it. No, baby girl, you don't want the doctor drawing your blood because they don't know how. Doctors don't draw blood. They put in central lines. They do venous cut down. They don't do blood. They don't do phlebotomy. So why do things? Hey, you got
I think people, and this is, I hope that this podcast, again, we're going to cover a lot of different topics. I want everyone to, as they age, be alive and kicking, because it is possible. You see me running around, you think, okay, Lisa, you are a former elite athlete, bodybuilder, whatever, but I can give you a list of people who can't do cartwheels. who
Mm-hmm.
can't do push-ups. I
Mm-hmm.
mean, I took it upon myself to do what you did.
Mm-hmm.
I went a different route. That's why I want to bring as many people on to explain what they did to be alive and kicking, because I'm telling you, growing old is the best thing that you can do. Tell them your self-esteem. When you grow older, you got the
Look,
experience.
when I go to LA Fitness, I just don't sit around. I play basketball with the young bloods, and I get my. And there's no way I could have done that.
No way.
Go.
But think about it. You are growing older and
Yeah.
enjoying it even more. That's what I tell people. They go, you don't look this age. You don't look that age. You look good. You look good. In fact, I'm thinking when they say, oh, look how beautiful you are, I'm looking around like, who are you talking about? Well, I'm not aging like everybody. 66, 65. I'm not aging. But so it's coming from the inside out, and I'm not doing what my peers are doing. So I'm saying growing older, I'm looking forward to it. And I know you are as well.
Lisa,
I'm looking forward.
Let me tell you what I'm mad at. When I started this journey, I used to do fasting. I used to do 3-day fast for autophagy. And once I started doing the autophagy, but autophagy is where you go 18, 19, 20 hours without eating. And it's like a cell cleansing process where the cells in your body eat up all the bad cells and make new cells. And what happened is my skin cleared up. My hair got blacker. My hair got thicker. All this because I would do a 3-day fast. And now I want to do the autophagy for my health, and I can't do it because I'm trying to gain weight now. I'm trying to get back 200 pounds. I'm down to 180 pounds. And
But that you taught me about that autophagy. That is huge.
Yeah,
that is huge. I still can't get to 3 days.
Yeah.
I have 2 days of fasting. But I'm still enough, right?
And when I do my 3 days, I'm at my peak as far as cognitive, being able to think, and my strength. Because I have measured myself. I've done tests of myself as far as lifting weights and doing calculus problems after I go 3 days without eating. I sleep, but I don't eat. And I drink water. I may drink a bone broth. And that is the best thing you could do for your body. Because like I said, I used to have blotchy skin. Now I go to the dermatologist. He's like, why are you here? Your skin is flawless. And it's all because I would do the 3-day fasting and the autophagy.
Yep. Well, like I said, I'm gonna have you back on soon.
Okay.
Real soon.
Okay.
First of all, I want to say Happy Father's Day.
Thank you.
Happy Father's Day is the weekend. It's all about you guys.
My oldest is not too far from you in California.
I can't wait to meet him. I'm waiting to meet him. He's a physician as well, right?
Yep, he's in internal medicine. His last year of internal medicine training at one of the Kaiser hospitals in Kempe, what's in that city? Kemp? I can't think.
Wait, I thought you said Beaumont.
No, it starts with a K, but it's one of the Kaiser hospitals. Matter of fact, he's supposed to be chief resident in internal medicine next year.
Oh, okay. Well, you've done a great job passing along the academic portions of being a father.
But Lisa,
he was growing up, but now, what's he doing? He's watching you grow older and healthier.
Yeah.
Do you know what type of legacy you've given your son and your kids? Because you have more than one son. You're giving them a double boost of academic, the studying, the discipline, and now growing healthy.
A healthy life now.
Yes, they're watching you. They're watching you.
That it's never too late.
This is your legacy. Remember, that's one of the things I'll never forget that you told me. I said, well, doctor, you're retired and you're going to be doing, writing a book. Go ahead and say the name of your book again, because we're looking for that soon.
Nor Beyond 50 Times to Change. Basically,
right.
It's a handbook for people of color to help them lose weight, attain wellness, to prevent them from getting the lifestyle diseases of diabetes, high blood pressure, cholesterol, heart disease by staying fit and healthy.
And culturally, we need something like
Yeah.
that, because
Yeah.
one of the things that you told me was, I'm not really looking to be rich. I'm not looking to make a lot of money. I did well, you did well, but you're looking to create a leg. That's what you told me, legacy.
That's what
And
I
it's
want.
not just all about money.
No, because I have talked to too many doctors that have talked about how Black women are so overweight that they don't care about themselves. And I tell them they do care about themselves. You guys need to talk to them like they're human beings. Oh, I had a blowout at a symposium because they felt like that the obesity rate among Black women was so high that Black women didn't care. And I had to tell them that Black women are the most educated group of people. They just deal with so much stress, and the doctors don't listen to them. And I said, you all need to listen to that Black woman when she comes into your office. Put it like that. I didn't make any friends that day.
No. Well,
No
I've
friends.
called on physicians as a pharmaceutical rep, and Black doctors have shared similar things that you said to me, and I promise you, I tell my folks, go in there with as much knowledge about yourself, about your numbers, know the medications that you're on and why, and just go in there knowing stuff, because you know what, they're going to hurry up and do their job. In their mind, sometimes they do think, just like what you said, that we don't care as a culture, but we do care. But when we walk in there and we don't know what's going on, we trust. That's our thing. Our hearts are big. We trust. But you have to understand that they're not trained for everything. They're not trained culturally. They're not trained for psychological issues. They're not trained for fitness. They're not trained for that.
I agree.
So we have to go in there as our own health advocates, know your numbers, know what you're taking, and I'm gonna have you back, because you're gonna go ahead and tell. You know what I want to know? How would you treat your patient? Now you just finished. Now, how would you treat your patients now? Everything that you know now, that's what I want you to talk about.
The two things that I would do now is I would tell them to not eat snacks around the clock. The ones that are diabetic, not eat snacks around the clock. And if they could,
why did you tell them that before?
We would tell them to eat a snack, eat 5 or 6 times a day, and at night we would tell them to drink orange juice and graham crackers before they go to bed. That was
I have a close friend. Lost his eyesight. He told me that's what he told me. I was trying to get you on the phone with him. Remember? He told me that he was supposed to snack. He told me that if he ate something sugary, he just has to up his insulin.
That's what
I want you to. And he said his nurses told him that there is no way that he's going to beat diabetes, and he's my age, exactly 6 weeks. Exactly. And I said, no, you gotta talk to Dr. W. You gotta talk to Dr. Harold.
You know how I feel about insulin after I took it for years.
Yes.
Feel about it?
And they need to hear this from you. And again, this is not medical advice. This is not medical. You still have to go to your doctor.
You don't give alcohol to an alcoholic. You don't give sex to a sexaholic. Why do you give insulin to someone who has hyperinsulinemia, insulin resistance, or diabetes? You're giving him a time.
And I want you to talk about that, because again, we're not giving medical advice. We're asking you.
Ask your doctor.
Pay attention.
I'm taking insulin if it's going to make me gain weight and it's not going to ever cure me.
Don't get off your medication without talking to your doctors.
Okay.
Don't, keep the advice of your doctor. And if you feel that your doctor is not giving you the right information, find another
doctor.
Even knows about.
Even a good nurse practitioner would.
Yeah. They stay up to date on a lot of
Yeah,
things
they
too.
do.
And I used to call them. They stay up to date. They know their pharmaceuticals a lot better
Yeah,
than some. Yeah, I'm
yeah,
not gonna
yeah.
say this out
I
loud,
look
but
at look, Lisa, I look at the nurse practitioners like Avis. They're number two, but they try harder. And I have
oh,
some awesome nurse practitioners who I would trust with my life. I'm not taking
okay.
away anything from a nurse practitioner. I have met some that are awesome, good. They were better than some of the physicians I worked with. So
Yes, me
just
too.
find.
I really I they're great. But
Mm,
they're I cut you off. You have a second thing that you were gonna that you would tell your patients, and then we're gonna go ahead and end it and bring you back on.
okay.
What was the second thing that you would tell?
Was it about my phone call?
Well, no, you said that you would tell them the first thing you would tell them I said, how would you treat your patients differently?
Okay.
And the first
Okay.
thing was
At first, it was to not eat a big breakfast.
big work, right.
Not eat. That's the worst thing you can do because when you wake
That's
up in
the
the
second
morning,
thing, right?
yeah, that's the second thing. When you get up in the morning, your body has made a hormone, norepinephrine, cortisol. Basically, your blood sugar is going to be high, and the hunger hormone is low, so you're really not hungry. So why do you get up at 7 o'clock in the morning, eat all these carbs, refined sugars, cereal, orange juice, pancakes, waffles, knowing that you have a problem metabolizing sugar with high insulin to begin with?
Mm-hmm.
That means you have to take more insulin, and that means you're going to be hungrier within 2 hours. Now, when
Right,
you get up in the morning, if you have to eat something, probably eat some eggs, bacon, something that has high satiety and protein, where you won't get hungry in 2 or 3 hours before your lunch. That's
right,
what would help a lot of people with
right,
if they eat a highly satiating protein fiber breakfast.
right. Well, I'm gonna have you on again. This is fantastic. Um,
Okay.
thank you so much. Happy Father's Day.
Thank
Happy Father's Day to you. And again, good luck on that test. When are you taking your
Probably in
certification
a
test?
couple of weeks. In a couple of weeks.
In a couple of weeks. Well, good
Uh,
luck on that. And
okay. Thank.
I know you're gonna do well. You're gonna blow it
Okay.
up. You're gonna blow it. What do they say? You're gonna blow it out the water. You're gonna
Oh, got to. That's the only thing I know how to do.
okay. Okay. Well, God bless.
Thank you. Yeah,
And thank you so much. Okay. We're gonna
I
go ahead and end it
like if
here.
I can help just one
Thank you.
person with.
Can I ask them to do one thing for me?
Okay.
You need to subscribe to my YouTube channel.
Okay.
That's Coach Lisa Renee. You spell Renee, well, Coach, you know how to spell Coach, right? Lisa, Lisa, Renee, Renee. Like, subscribe, and share. And please comment because I'm having Dr. Harold Wagner back on again. I want you to comment, put in the comment section questions that you have for him so he can be prepared to answer some of those questions. Because I know this is a little tease here. He's going to give you more detail later. He's
My
going to
20
answer those questions.
my 20 holistic.
Yes. He's going to answer those questions. So put that in the comments. Let us know what you thought about this episode, what other topics you want to hear as far as growing old and being alive and kicking, because we have youthful appearance. We're not going to get fatigued, so we're getting rid of that drain, that energy drain. Ageless activity, so we can feel all the way live.
All right.
Thanks, Doctor. Thank you.
My pleasure, Lisa.